Okay, welcome back. Today we are doing a deep dive into a really fascinating fungus, Trametes versicolor. You probably know it better as the turkey tail mushroom. It's one of the most studied medicinal mushrooms out there.
It really is. It has a long history, especially in traditional Chinese medicine and Japanese Kampo.
Right, and our mission today is really to figure out why. Why did this specific mushroom get, well, formalized, turned into actual pharmaceutical adjuncts in Asia? We're
What's it?
talking about PSK in Japan and PSP in China.
Exactly. And the story with PSK, or Creston, it's pretty significant. It got pharmaceutical approval back in the 1970s in Japan. And that wasn't just because it showed promise, it was because they managed to create a standardized extract. Consistent, reliable.
That standardization piece sounds crucial. It sets a high bar, doesn't it, for, everything else on the market.
It absolutely does.
Yeah.
That's the gold standard we have to measure consumer supplements against.
Okay, let's get into what you called the formulation trap, because it seems like where things can go wrong for people buying this stuff. You said the clinical data relies on these standardized extracts. So how does a regular person tell a good product from, well, basically useless filler?
What really boils down to what part of the mushroom they're using and how it's grown. A lot of supplements use the mycelium. It's the root system, basically.
Okay.
And it's cheap to grow, sure. But the problem is it's usually grown on grain, things rice, oats, that kind of thing. And you can't really separate the mycelium from the grain it grew on.
So you end up with a lot of grain in your mushroom supplement.
Precisely. It dilutes the actual active compounds, the beta-glucans, with indigestible starch. So effectiveness just plummets.
So avoid mycelium grown on grain. What should we look for instead? The actual mushroom cap, the fruiting body.
Yes, the fruiting body. The mature mushroom. But even then, just grinding it up into powder isn't enough.
Right.
Because those beneficial compounds, mainly the beta-glucans, they're locked inside really rigid cell walls made of chitin. Our digestive system just can't break down raw chitin.
So you're just eating it, but not absorbing the good stuff.
Essentially, yes.
Yeah.
That's why you absolutely need to look for products that specify hot water extracted fruiting body. That extraction process breaks down the chitin and makes the beta-glucans bioavailable. Ideally, you want to see a verified beta-glucan content too, maybe over 30%.
Got it. Hot water extracted fruiting body aiming for 30% beta-glucans. Okay, so assuming we have the right stuff extracted properly, what's it actually doing in the body? We hear so much about cancer support. What's the real science there?
Well, the clinical evidence is pretty solid, but it's specific. Turkey tail, or rather PSK, acts as an immunomodulator. It doesn't kill cancer cells directly.
Okay, so it's working with the immune system.
Exactly. It fine-tunes it. And the structure is fascinating. PSK have those protein-bound beta-glucans we talked about, but it also contains a lipid component linoleic acid, which acts as a toll-like receptor 2 agonist, a TLR2 agonist.
TLR2. What does that mean in simple terms?
Think of it like a specific key that unlocks a certain response in your innate immune system. It's a pattern recognition signal that basically says, hey, immune system, time to pay attention.
Interesting. And clinically, where has this been most used? You mentioned adjunct therapy.
That's right, primarily as an adjunct to chemotherapy, especially for lung, gastric, and colorectal cancers. The typical dose is around 3,000 milligrams of PSK per day.
And what's the main benefit there? Helping chemo work better or something else?
The most validated benefit is actually mitigating a major side effect of chemo. Bone marrow suppression. Chemo often tanks your white blood cell and platelet counts. PSK can help support those counts.
Which means patients might tolerate chemo better, stay on schedule.
Exactly. And staying on the planned treatment schedule is hugely important for the overall outcome.
Okay, that makes sense. But it's not just oncology, right? I've heard about gut health benefits too.
Absolutely. Beyond the immune effects, turkey tail is a powerful prebiotic. Those polysaccharides, the beta-glucans, they resist our own digestion. They travel down to the colon.
And feed the good gut bacteria.
Precisely. They selectively nourish beneficial species like bifidobacterium and lactobacillus, so it acts like a high-quality fiber, fueling your gut microbiome to produce beneficial postbiotics like short-chain fatty acids.
So it's powerful stuff, which usually means we need to talk about safety. Given how strongly it interacts with the immune system in blood, who needs to be really careful or even avoid it completely?
Yeah, caution is definitely needed. Because it ramps up immune activity, anyone with an active autoimmune disease really must avoid it. We're talking MS, rheumatoid arthritis, lupus. Taking turkey tail could potentially trigger a serious flare-up.
Okay, that's critical. Autoimmune conditions are a no-go. What else?
It can also affect platelet counts. So Individuals with bleeding or clotting disorders, or anyone taking anticoagulant or antiplatelet medications like warfarin or even aspirin should avoid it due to the risk associated with potentially lowering platelets.
Right. And drug interactions generally.
Definitely needs medical supervision if you're on other meds. It can interfere with the metabolism of certain drugs, notably cyclophosphamide and tamoxifen. And very importantly, it can lower blood sugar on its own. So combining it with anti-diabetic medications carries a real risk of severe hypoglycemia, dangerously low blood sugar.
Wow. Okay. Any general advice? Like before surgery?
Yes, the standard recommendation is to stop taking it at least 2 weeks before any scheduled surgery because of the potential effects on bleeding and immune function.
Okay, so let's recap the main takeaway for you listening. If you're looking for the benefits seen in clinical studies, you really need that specific hot water extracted fruiting body powder, ideally with verified beta-glucan levels. Otherwise, you're likely not getting what you think you are.
That's the crux of it. The preparation dictates the efficacy. It has to mirror, as closely as possible, the standardized extracts like PSK used in the research.
So thinking about those components,
Yeah.
the beta-glucans, which are like complex sugars, and that lipid part, the linoleic acid.
Yeah, it raises an interesting point, doesn't it?
It does. How might the context you take it in matter? Like if you consume that extract along with some healthy fats.
Could that potentially help unlock the full synergy, given it contains both sugar-based and lipid-based active compounds?
Maybe enhance the absorption or action of that TLR2 agonist. It's something interesting to consider how diet might interact with it.
Definitely something to mull over, how context influences the potential of these natural compounds.
Food for thought. Until next time.